Good morning, everyone. My name is Michael Burnswag. Today's date is 5/30/2025. This is my note sheet. All right. Today I am going to be talking about myocardial infarctions, or MIs, or better known as a heart attack. Um, Heart attacks and MIs are actually the leading cause of death globally throughout all populations. Um, so now let's kind of get into, actually what an MI is. So a MI occurs when blood flow to a certain portion of the heart, um, to the heart muscle, is completely or partially blocked off, most commonly due to a blood clot in the coronary artery. So what happens when there's a blood clot in the coronary artery is you know, that oxygen-rich blood that the arteries, the coronary arteries carry to the muscle, the muscle isn't able to get any oxygen. So that's where the term infarction comes from, which means tissue death caused by lack of oxygen. Um, so let's get into how MIs are classified, and there are a few different ways to classify them. Uh, the first one is a type 1 MI, and that is caused by a plaque rupture in the coronary artery. When this plaque ruptures, it triggers, the body's clotting cascade, which then forms a clot inside the coronary artery and then blocks flow. The second, uh, the second one is a type 2 MI, which is a little different. A type 2 MI occurs when the heart's oxygen demand is greater than the supply of oxygen in the body without any blockage occurring. So this is going to happen, let's say, in hypoxemia, um, if there's not enough actual oxygen, within the blood to then supply the muscles, an MI can occur. Um, and some other ways to classify it would be a STEMI and a non-STEMI. Uh, so a STEMI is an ST elevated myocardial infarction, which means there is a full blockage within the coronary artery, and that would be very evident on a 12 lead ECG, and you'd see the ST segment elevation. An NSTEMI is a non-ST elevated myocardial infarction, which usually means that the artery is partially blocked. We won't see ST elevation on an ECG, but that does not mean that damage is not being done to the heart. And that's very important to know. So what can cause an MI? So usually the number one cause of an MI would be arthrosclerosis. Arthrosclerosis is a condition where plaque builds up within the artery walls over time. Um, so this plaque formation can rupture, and if the plaque formation ruptures, the body triggers, like I said before, the its clotting system, and then once it clots, it forms a clot inside of the artery, which then causes a sudden blockage. And there are several risk factors to contribute to getting arthrosclerosis and an MI, which would be smoking, high blood pressure, diabetes, hyperlipidemia, obesity. So now let's dive into what syndrome an MI falls under. So that would be MI would fall under a coronary syndrome. Coronary syndrome is kind of a spectrum of heart conditions that all involve reduced blood flow to heart muscle. So that could include unstable angina, NSTEMI, like I mentioned before, STEMI, which I also mentioned before. And the main difference between all these is how complete the blockage is and how much damage is being done to the heart muscle itself. So now, what would some clinical manifestations be? What would a patient coming in with potentially an MI, what would be their chief complaint? So some signs and symptoms would be, more often than not, someone's going to come in saying they have, extreme chest pain. Um, and that chest pain could be radiating to the left arm, the neck, the jaw, the back. Um, or they could say that they have, an immense amount of pressure squeezing, even crushing or a heavy feeling in their chest. A big, a big complaint usually is, they feel like an elephant is like sitting on their chest. Um, some other signs and symptoms could be shortness of breath, sweating, nausea, vomiting, palpitations. Uh, it is also very important to note that some populations uh, can present with very different signs and symptoms than what I just mentioned before. Some very atypical symptoms, and that group would usually be women, elderly patients, and people with diabetes are more likely to present with atypical symptoms. And these symptoms could, just simply be fatigue, back pain, or even just a vague sense of just not feeling well. So it's very important to know that because someone, just because they're not coming in saying they have like an elephant is sitting on their chest, it does not mean, that damage is not being done. Um, so it's very important to know that. And if we suspect, someone comes in, with these signs and symptoms, or we suspect someone could be having an MI, how would we diagnose? Like, what is the diagnostic test that we use, to diagnose this? So, uh, always like right off the bat, a 12 lead ECG will be done, an electrocardiogram. So basically, a 12 lead ECG will give us a snapshot of the heart's electrical activity. And in a STEMI, like I had mentioned before, we will see ST segment elevation. Um, which would mean that there is a full blockage occurring, which is, a cardiac emergency. Also with the 12 ECG, you'll be able to, really pinpoint which part of the heart, is being affected. Also, another test that we use would be, a blood test checking troponin levels, cardiac biomarkers. Um, so troponin is a protein released by the heart, by heart muscles when they are damaged. So, extremely elevated troponin levels would indicate that there is myocardial injury and that injury has occurred even if you're not seeing ST segment changes. Let's say they're having an NSTEMI and their troponins are through the roof. That is another diagnostic tool. So now what's a like a differential diagnosis? Someone comes in, with signs and symptoms, that could, also present like an MI. And one of them would be, ruling out pericarditis. Pericarditis is the inflammation of the sac around the heart. And it also causes chest pain. But the chest pain that occurs with pericarditis is usually very sharp, and it also worsens with deep breathing and also lying flat. And it actually tends to, like, the pain tends to improve when the patient sits up and leans forward. So, I mean, you're not going to see someone with an MI that's going to be able to, reduce their pain level just by sitting up and leaning forward. So that's a big difference there. Also, in pericarditis, someone coming with chest pain is going to get a 12 lead ECG regardless. And someone with pericarditis, you're going to see ST elevation in almost every single lead. Um, and that is not typical in an MI. In an MI, usually the ST segment changes you'll see that, really localized to which portion of the heart is being affected. Also in pericarditis, there might be elevated troponins, but it won't be, as high as someone who's having a full-blown MI. Um, yeah, so what happens, you diagnose it, you know, you recognize the signs and symptoms. So what are the complications, if an MI or a STEMI isn't treated in time? It would be fatal. If a STEMI is occurring, um, and too much of the heart muscle is damaged, someone will go into severe heart failure. Your heart won't be able to pump effectively because, the muscle isn't able to be, utilized. Fatal arrhythmias can occur, especially depending on which portion of the heart it's affecting. But like a patient could go into ventricular fibrillation if untreated, and that is not a life-sustaining rhythm. Cardiogenic shock, also a complication where the heart can't maintain blood pressure or perfusion due to the inability to pump. Um, and yeah, that's really everything I wanted to cover regarding MIs. I appreciate everyone for listening, and I hope this overview of what an MI is really, helped teach something today. And thank you everyone for listening, and thanks.